We've served Clarksville residents for generations, and our first site in the Clarksville community in Montgomery County opened in 2005. Over those last 2 decades, we've now expanded to more than 14 locations, serving more than 150,000 patient encounters every year. The more we interact with our patients and our doctors in the community, and what we've consistently heard is we want more services closer to home to reduce that burden of traffic and travel to Nashville. We're just so honored to be entrusted to bring a comprehensive hospital and health campus to Clarksville, right here in the heart of Montgomery County.
Our people are what make our community so special, and on July 23rd of last year, our people turned out for the hearing to grant our community another hospital, and Ascension Saint Thomas was our clear choice to be here. What it means is our community will finally, after 240 years of history, have more than one full-service hospital to provide outstanding care. It's a known, trusted brand, and we're just excited to have Ascension Saint Thomas as part of our community officially.
The excitement and positivity that we saw from the announcement stems from people's experience that they already have from interacting with Ascension Saint Thomas in Nashville. They already know what to expect. They already know what quality that they're receiving. They're just excited to have that here closer to home, where when they do run into issues or they need help with something, they know they're going to get the right kind of service.
St. Thomas building a hospital here is probably one of the 2 or 3 biggest things that's happened to Clarksville in the last 50 years. It's a dream come true. You know, it's something I've been looking forward to since I've been here, which has been 40-something years. The impact can't be underestimated. I think the community's ready for it. St. Thomas's reputation is impeccable. They're going to build a first-class facility. It's just the best thing that could possibly happen. They've worked with Ruther Boyd, who's a family practitioner here in town since 1983. He was one of the team doctors for Austin Peay State University. He was one of the kind of walking legends around here. You know, he was a good, genuine person who looked out for the best interest of the community, and I can tell you, he would be delighted with this hospital. He was a big St. Thomas fan in a lot of ways. He had close connections with him his entire practice life, and he would be ecstatic with this, I'm sure.
The Boyd family has a legacy in the community of Clarksville. Families all around the community have visited there for years at the pumpkin patch. Dr. Boyd has been a longtime community physician. Miss Boyd has sat on and served on so many boards for the community. They're just a staple in the community. And so for us to be able to carry on their legacy on a 96-acre farm that means so much to their family is truly an honor and a privilege. Our plans for the Boyd Family Farm are so much more than just a hospital. It really is a health campus that is for the community. Our goal is to provide services and access to other health care, such as PT, imaging, ambulatory services, to really create a campus around wellness. So in addition to a hospital, we'll have walking trails, restaurants, retails, that it really is a place for the community. We had the opportunity to meet the Boyd family, specifically Miss Boyd. Dr. Beasley and I spent really half of an afternoon with Miss Boyd. In that moment, I quickly realized that this was the place that we had to create a health campus for the Clarksville community.
I'm very happy to sell the farm for St. Thomas Hospital, where I was born in 1935. We badly needed a hospital here because over 50% of the people were going to Nashville. When we moved to Clarksville, my husband had just finished medical school. He was a chemist. He graduated from Austin Peay. Doctors were needed badly in Clarksville, and he was going into family practice. We came here. He did a little of everything, sewed people up, delivered babies at the time. We moved into an old farmhouse.
Then in 76, 77, this property became available. A person had been a patient of my father's. They had no children. My father had admired the property for years, the farm, and he and my mother bought it. The interstate was just opening up at that moment. And at that time, I was 19. My father told me if I wanted to buy a certain car that my uncle had restored, he said, you can grow the tobacco crop out on the farm. and get the money for the car that way. So that got me started farming. He was doctor for Austin P at their sporting events, and he went to the infirmary there and saw students at Austin P for maybe 2 decades. But he was just a very practical, smart doctor.
The whole family is very happy about having it a hospital here. I felt like the first meeting, we clicked together. I'm so thankful that it all worked out like it did. Thank you.